Does your child have the following symptoms? 1. Not responding and no eye contact. When you call their name, they do not look at you, they ignore you, or they are avoiding their contact or not looking at you when you are talking to them. 2. Has speech delay or speak jargons or scripts. Can they communicate with you in simple phrases at the age of 2? Or do they repeat what they have seen in TV or YouTube? 3. Has poor play skills or play alone. Do they play alone and ignore other children? Or they seem to have no idea in play but sweep all the toys to the floor repeatedly, spin the toys or wheels, line up toys, and so on. These are some of the symptoms of Autism Spectrum Disorder, ASD, or commonly known as autism. If you have any concerns on your child's behaviors or milestone, please talk to the related professionals. Research has shown that the earlier the interventions, the better the outcome. Earlier intervention may help to improve their skills and reduces autism symptoms years after the treatment. In Child Development Center, CDC, we have a team of specialized medical professionals and allied health professionals such as developmental pediatrician, clinical psychologists, speech therapists, occupational therapists, audiologists, and so on. ASD is usually diagnosed by a developmental pediatrician or clinical psychologist. As a clinical psychologist, I help to screen and assess the child and then refer the cases to the relevant therapists for early intervention. If needed, I may also do formal assessment using standardized psychological testing tools as well.
As a speech-language therapist, I help children with communication needs to communicate effectively according to their everyday needs. Children with ASD usually have social communication challenges, which sometimes lead to lots of frustration for both the child and parent. There are several areas that children with ASD might struggle with. Firstly, we commonly use the term speech delay. But speech is technically just referring to the clarity of sounds in words. If your child says "tawet" for carrot, that is considered a speech error. However, for the child to say "tawet," they need to know that the word carrot is an orange, crunchy vegetable. This knowledge of words in the brain is known as language. More commonly, we will see children with ASD not speaking as much as they could or not speaking at all. This is usually considered a language difficulty as they have not yet learned how to understand or use that vocabulary. Another area that children with ASD commonly struggle with is social communication or pragmatics. This can look like a child that seems to be speaking very well, but is unable to understand social norms. They can be overly talkative, go into tangents in conversation, or simply not interested at all to interact with other children. We can sometimes see this in younger children who avoid eye contact and looks like they are not listening. They seem to be in their own world and show no communication intention. As you can see from the many areas of difficulty, these children fall on a broad range of spectrum, hence the term Autism Spectrum Disorder. They can have different strengths and weaknesses, so there is no one-size-fits-all intervention. So speech therapy aims to capitalize on your child's strengths and address their weaknesses to enable them to communicate effectively. For example, if a child is not speaking yet, but he's able to show you communication intent, he can bring you a box for you to open, and he can imitate actions, then we would use this as his strength to enable him to communicate. So we might show him how to sign the word open. If he learns to use that the next time he wants to request, he is communicating effectively. And more importantly, he is learning language that is fundamental to speaking. This will greatly reduce the frustration that the child has in being unable to express themselves. We also equip parents with parent-child interaction strategies so that parents themselves are confident to support their child's communication at home.
Occupational therapy helps children to maximize their functional abilities and to enhance their participation in day-to-day activities. An occupational therapist will work in collaboration with your family to help improve your child's function and participation through therapeutic play. As a pediatric occupational therapist, it is within my scope of practice to utilize child's occupation, which is play, to facilitate treatment and intervene with skilled therapy using play. Since play is a child's #1 occupation, I utilize the sensory gym for a variety of intervention approaches to engage in child in a fun and enjoyable way. Play can be defined as any spontaneous or organized activity that provides enjoyment, entertainment, amusement, or diversion. I just have an understanding of what playing in the gym looks like within the scope of occupational therapy and the impact it can have on one child's sensory systems. Sensory systems include our visual, auditory, gustatory, olfactory, tactile, proprioception, and vestibular system. All of these sensory differences described are part of the neurodiversity of human life. Just like the diversity of physical attributes, personal preferences, characteristics, sensory differences are just one more difference that makes us who we are. For example, you close your eyes for a minute and just think about all the sensory input that you are experiencing. Do you hear any sounds or smell and sense? Can you feel what you're sitting on? Does your body know whether you are sitting up or lying down? How does your clothes feel against your skin? And how is the faint tick of a clock sound and the flicker of light affecting you? Some of us may not feel these micro-sensations as our brain filters them out, but for children with ASD, everyday sensations are felt with greater intensity, which often lead to distraction or avoidance. They could be over-responsive or under-responsive towards any input. Switzerland multisensory environments, also known as sensory rooms, provide an engaging environment that contains a variety of tactile, visual, olfactory, and interactive activities. Many activities can be graded to provide appropriate challenges for a range of sensory, cognitive, fine motor, and gross motor skill levels. It can provide a place for an individual with special needs to go when a meltdown occurs. But it's not just a place for a timeout. While it can be a calm space where they can regain control of their emotions, a sensory room can also provide a low-stress, fun environment for an individual to work through their emotions and reactions to certain stimuli. Sensory rooms are important because of the endless opportunities for sensory-based input, changes of alertness, and social interactions they can offer to a vast majority of patients, regardless of the different needs of each person. Sensory rooms and occupational therapy are alike and important as each are both tailored to the needs and focus of improvement of each person to bring them to their highest level of ability and tolerance that they can be. Children with ASD can have trouble combining sensory information in this way. The idea is to use physical activities and exercise to help the children learn to interpret and use sensory information more effectively. We provide both alerting and calming strategies which will bring benefit to a child's daily life. It can make a real difference by helping individuals to manage their sensory sensitivities and cravings. Further advice and ideas specific to your child's needs can be discussed upon meeting your therapist.
Early intervention is key to helping a child reach his greatest potential. This is because connections in your child's brain are the most adaptable to change in the first few years of life.
Look out for early signs of autism which usually appears before the age of 2 years old. Some of the signs are makes little or no eye contact, may not respond to name calling, plays with parts of toys instead of the whole toy, which means they have poor play skills, and much more.
And parents, yes, it is stressful and not easy to take care of children with special needs. Do not hesitate to seek for help when needed. Psychologists can support you in parenting strategies, child behavioral management, as well as your mental wellness.